on the first question, you have in D, you want to restore a sense of financial certainty to our personnel. How are you going to do that?
Well, you know, we've all. I'm going to stand up. Is that all right?
Go right ahead.
You know, we've weathered the storm. You know, we've had to stand our ground and hold our ground, and that's what I've tried to do is, you know, keep at least everybody whole while we got through this. Things seem to be turning around. I think they are. You know, we looked at this year's budget that's was just submitted that we're going to have the public hearing on. Haven't heard any issues. You know, come in flat. We can do flat. So I would think things are turning around. If you listen to all the indicators, things seem to be getting better. So we just got to get back on track. My thing was to at least keep what we have, stay whole. Let's try to maintain what we have. So that's why I like this year, putting back the longevity, putting back the step increases, and now we can just try to move forward and try to recover some lost ground.
Okay. The question on getting along.
We'll be talking about that on Wednesday. We have a meeting Wednesday at 10 o'clock. So we'll be able to discuss some details of that on Wednesday.
And I understand we might get a package offered to us.
Yes.
Good. I think Scott Israel knows more about the package than we do.
And we're coming here.
Right. You're coming to our backyard. Appreciate that. The question on county commissioners, getting along with county commissioners. That question was asked, of course, because some of it's been a little contentious between you and a couple of the commissioners.
Right.
And your answer, first I got to ask, has any of them come out and endorsed you by any chance?
No.
They wouldn't do that, I wouldn't think.
And I haven't asked for any of their endorsement. What I told them last time, we're colleagues. We need to work together. I'm not going to endorse anybody against you. You know, I may be asked to. I told we're colleagues. We have to work together. It's hard to negotiate anything, whether it be a budget or a purchase, when you're sitting across from someone who's endorsed your opponent. So I asked that I would never endorse somebody against you. I would appreciate it if you didn't endorse anybody against me. That way we're on a level playing field when it comes to budget, purchases, programs, everything. We're colleagues.
Okay. And I think they've stated that is what we've heard from the other candidate. And you mentioned in your answer to us, including participation from the PBA. And I've had conversations with you, and I want to make sure you understand that at any time you need a PBA to go with you to see any county commissioner regarding, you know, things that have to do with us, we will be there. And all it takes is an invite from you to go along with you and make sure these county commissioners are supporting, since we support some of them, you know, we would expect support back.
Well, and that's what we need, is we need a united front no matter what the issue is. The past 5 years, I'm not saying they were contentious, but you know, we're all battling over reduced budget dollars. They have their programs, we have our programs. But you think about some of the things that have come up that I've written that we've had to deal with that are very difficult issues. In good financial times, they would never be an issue. But the fact that, you know, you're under tough economic times and a strain, they become an issue. The jail population, we had to close the stockade. That was a big battle on the DOD side that we had to talk about with the commission, whether to do that or not. Regional communications, everybody agrees that regional communications is the way to go. 13 PSAPs is not the answer. There needs to be regional communications. Everybody agrees, but nobody can agree how to pay for it. So we've had those discussions. Fort Lauderdale Dispatch, you know, they haven't paid us. Like Lauderdale Lakes, they stopped paying. They paid 3 months and they haven't paid since January. So how do you resolve that? We don't have the money in our budget. The county doesn't want to pay, and Fort Lauderdale doesn't want to pay. Well, somebody has to pay. We have 79 comm operators over there. So we've had to discuss that, battle about that. Lauderdale Lakes, you know, $9 million in the hole. The only thing I can tell you from a good standpoint, this fiscal year, they have caught up. Not caught up, but they're paying on time. So every month they're paying on time. So this fiscal year we're good. Problem is last fiscal year they owe us the $9 million. They paid $1 million of that down. And so they're down to $8 million. But just so everybody knows what happens to that money when they pay us. You know, that's like an accounting practice, it's a receivable. We've laid the money out because all the deputies that work there got paid, even though Lauderdale Lakes didn't pay us. We had to find the money and work with the county to do that. So as they pay us that, they're trying to pay us about $500,000 a month to pay down that debt. That money goes back to the county. But the good thing is, for this year, they're good. South Satellite booking, you know, we had to close that. That created a strain on everybody who's in District 1, District 2, not to mention Pembroke Pines, Hollywood, and Miramar. But that is back in this budget that we're submitting October 1. It's back in the budget. It's going to reopen 16 hours a day on October 1st. We've already made arrangements down there, met with the Hollywood folks. So October 1st, that will be back online. That's going to be a big help for everybody in the South End. But we had to, you know, close that, had no other alternative, but that was one of the times we did go hand in hand with the PBA to meet with the commission over that, because that wasn't just a BSO issue. That was a police issue in the South End. And we did go hand in hand, but didn't get anywhere. Basically got shot down, even though that was a commissioner that you endorsed. But we have to do more of that. If we both lose, well, that's the way it is. But we have to try together, and we have to do more of that. The crime lab, you know, that should have never happened. That's another issue that start charging the cities. It's a county issue. It's a county resource. It's a regional resource. But those are the kind of things the commission tried to tell us, user fees. And I fought back on that because I believe there's only one crime lab. Everybody in the county pays for it. It's a county-wide resource. It's a regional resource. There's only one. Why should we charge the cities who pay county taxes for that? So I stood up for principle on that. They didn't like it. They wanted me to impose user fees on the cities for everything they brought to the lab, but I didn't agree with that. And so, you know, you can say we didn't get along, but I don't think there's anybody in law enforcement that doesn't understand that's a regional resource. You don't charge the cities for bringing in drugs. So all those kind of things. The only thing I can tell you is we have 2 new commissioners coming on, Marty Keir, Tim Ryan. I've already met with both of them. And sometime prior to them getting sworn in, which I think is the end of November, I told them I wanted them to come over and we would do a briefing day for each one of them, tour of the agency, meet with everybody. Love to have some of you guys sitting in on that briefing. Maybe we could do a half hour upstairs in the Lynn Futch with you guys and the 2 new commissioners as part of that orientation for them. Both of them are eager to do it. They're totally on board to do that. They want to hear what the BSO issues are. One of them lives in a BSO city, so he's got a vested interest in knowing what's going on with our agency. So I'm encouraged by those 2 commissioner-elects coming on board.
Okay. Okay. Seniority. Dear to our hearts.
As mine.
Good. Glad to hear that. Glad to hear that. We talked about days off, shift assignment, and district. And in your response, you're agreeing shift assignments and days off, not an issue. Am I correct? No denials.
Well, what's in the current collective bargaining agreement?
Right.
Okay, it was 1/3. Now it's 2/3. So if you want to bring that up on Wednesday, we can bring that up on Wednesday. But what's in the collective bargaining agreement is where we're going to start. Vacations are already done. My opinion, days off should be strictly by seniority, and if there's been some inconsistency on that, we can, you know, firm up the language on days off. Shift assignments, what's in the contract now is it was 1/3, now it's 2/3. So 4 out of 6 shift days.
And we don't want, in our proposal on the table, so we're very clear, I thought that you're kind of, in your answer, it says, I believe that seniority should be a top priority for our deputies, with regards to annual leave and shift assignment.
Well,
Being a top priority means no denial on our part. You understand it that way?
No, the deputies get 2/3, the agency gets 1/3. So that's twice as much. Well, we can talk about that on Wednesday.
Okay. That'll be very interesting conversation Wednesday. On your insurance, I know you have a...
I do want to cover the district assignment real quick.
Oh, yes, I'm sorry. I do too.
Because that has come up quite a bit.
Right.
You know, that would be great. I mean, it's not practical for a lot of reasons, and I want everybody to know, what they are. Number one, our municipal contracts. Over the years, the city managers have asked for more control on who comes in and out of the district. They haven't been happy with people being moved out without their input. They haven't been happy with some of the people that got transferred in. The commissions, city commissions, and the city managers, they like the deputies that are there. And with the philosophy of community policing, knowing the residents, knowing their zone, knowing all the community things that are going on, they've stressed we want stability. We don't want people moved in and out. So that's one issue. Second is financial. We try to balance the districts as far as seniority across the board because of finances. If all the senior people go to one district, well, that budget, because the cities pay actual costs, we calculate every deputy that's in that district, their salary. And if everybody, all the senior people in one district, that costs go up. And if I've actually had city managers come to me and tell me, I want deputies out of the academy. Don't send me any senior deputies. I want deputies out of the academy because I'm trying to control costs. That doesn't work either. I've told them that, nope, sorry, that doesn't work, for us either. You can't have all the junior deputies for the same reason you can't have all the senior deputies in one district. So that's the second part of it, that the city managers are exercising, their authority to resist people coming in and out. But I do want to add about transfers. We are changing the way we do transfers. In fact, I've changed that. Anybody can transfer to any district at any time. We have maintain a list, a transfer list for every single district. Probably not a surprise to you, the top three are the courthouse, the airport, and Port Everglades. That's where everybody wants to go. But we maintain a list for everybody. It changes every 90 days. You reapply that way. If somebody decides at the last minute, well, I didn't get in last time and I want to go to the courthouse, every 90 days we start from scratch. And those transfers, if a vacancy occurs in a particular district, we go to the list, who were transferred to that district, Dania Beach. We look who put in who wants to go there, and we do that by seniority, absent any other extenuating circumstances like discipline issues that the city manager is going to reject the person. But that's done strictly by seniority. So I think we need to look at that as well. In the district assignment part, transfers are right now being done, strictly by seniority.
Okay. Insurance, big issue. You gave a 30, 45-minute talk about, I don't know if you want to go over all that. I mean, most of these people were at the bargaining table, but some people out there were not. But, your idea on this self-insurance and the clinics and so forth.
The healthcare issue is not going away. And I don't want to get in the position where every year we have to sit down and redo this every year. We agree that impasse was not the thing to do. Going before the county commission to resolve our internal issues, in my opinion, was not the thing to do. And I know you agree with that. But we have to get past that, put it behind us. Where are we going from here? I think the answer is self-insurance. That way, every year we don't have to do this, number one. With the federal health care reforms coming down the pike, things are going to change. Don't know how they're going to change, but they're going to change. And I think we're better off being in control of our own destiny when it comes to health care. Everybody in the industry that I've spoke to, from Blue Cross to Blue Shield to competitors, should we be self-insured? I asked deputies at the gas pump, how much do you think we pay as an agency for health care? And I get 10 million, 15 million. We pay $60 million a year for our employee health care. That's 10% of our budget. 10% of our budget is our own health care. Everybody unanimously has told me, with that kind of budget, you should be self-insured. That way you control your own destiny for that amount of money. Here's why. If you have a good claims year, you pay 60 million, they only pay out 58 million, where does that other 2 million go? Insurance company keeps it. Whereas if we're self-insured, we keep that 2 million. Now next year we have 62 million to work with. And on and on and on. This year, we're in a bad claims year. For every dollar we pay in premium, they have paid out $1.07 in benefits. Okay, so we're upside down. And our own consultants tell us the worst time to go out to bid is in a bad claims year. You want to go out in a good claims year. We've had, within the past 5 or 6 years, we had 1 year, for every dollar we paid them, they only paid out 82 cents in benefits. What happened to the other 16 cents? It's profit.
Oh, that's 18.
18. There you go. 82 minus 100. So they keep that. I mean, they bank it in case they have a bad year like this year. As an example, this year we've had $4 million claims. One of them's $1.7 million. That never happens. Okay, it's just catastrophic this year. But I can tell you, and for those 4 claims, none of them were employees. They were all family members. But I can tell you, the person whose family member was paid out that $1.7 million, he's probably very happy with Coventry. Because they've taken care of $1.7 million worth of bills, you know, that he doesn't have to worry about. And so we're in a bad claims year. We sent a team up to Palm Beach Sheriff's Office. Coventry, our HR people, and our command staff people to look at their system. They have on-site health center. It's staffed by a doctor and a nurse. They do x-rays and MRIs. You go there, that's your primary physician, if you so choose. You want to go to yours, you pay the co-pays and the deductibles. But the advantage to that, the incentive for that, all co-pays are waived. There's no co-pays. Also, they're looking at on-site pharmacy. And we're looking at that too, where the doctor can write a script and they can fill it. So it's something, you need a Z-Pack, you need some routine medications, you get it right there, no co-pays. That way we can manage our own costs. As part of that, and we met today with Tenet. Tenet is the healthcare company that runs the clinic in Palm Beach, ESSA. That's the group of doctors. So I called Sheriff Bradshaw and I said, hey Rick, we're thinking about doing what you did. We sent a team up there, they looked at it, they loved it, we talked to the deputies, they love it. We're going to do the same thing. But how about this? If we get Coventry to get Tenet to run our clinic, would you let our deputies use your clinic and I'll let your deputies use our clinic? Because we have a lot of people live in Palm Beach. He's got people in South County, in South Boca. They could come here just as easily. So he agreed, absolutely. Tenet doesn't care because if they're running that one and they're running this one, to them it doesn't matter. It's still Tenet, same system. So that's the kind of thing we're looking at. I went to Coventry. This is what we want to do. Would you build us a clinic? The investment they would have to make in this clinic is about $250,000 to build out a clinic. We're looking for somewhere in the building to do it. They're willing to invest that $250,000 in building a clinic, but not if we're going out to bid. Because I said, why should we invest $250,000 and it's for 1 year? And then somebody else comes in and gets the benefit of our clinic that we built. So that's the trade-off. I'm not waiting to 2014. My goal is to be 2014 to be self-insured, January of 14. So that means we have to get through 13. We go out to bid for 1 year at a $1.07, claims ratio, and turn down this $250,000 clinic? Or do we let them start the clinic now, have it on board for 2013, and then 14 we go self-insured? To me the answer is pretty clear. Stick with them for 1 more year, go self-insured, let them put the clinic in, and part of the talks as well is they said they'll go to Tenet. They're willing to negotiate with Tenet, just like Palm Beach has. And also to look at, on the Boca Deerfield line, an emergency center that is operated by Tenet, that would be also a BSO clinic, that you could go in there and no copays. And then we have to start educating our own people. Don't run to the emergency room when you stub your toe. Kid has a runny nose, take him to the clinic, get the Z-Pack. And if we start doing that, we'll be able to do some financially good things. The advantage is, and I don't want to say a profit, but a surplus. If we have a surplus, a $2 million surplus, next year we have $62 million to work with. Do we reduce the premiums? Do we increase the benefits? Do we put the gym memberships back in? But we design the plan. We sit down and design the plan. And if people are not happy with the plan, who do you blame? Us, okay? All of us. And that's the advantage, I think, of doing self-insured. We design the plan, we price it out, we can decide what we want based on how much we have to work with, but any surplus we generate comes back to us to use to enhance the plan. People ask me, what if we have a bad claims year? Well, how you do that, you buy catastrophic insurance to protect yourself in case you have a bad claims year. And that's reinsurance. You're insuring yourself against insurance. So if you have a bad year, then you go into that insurance fund, and you can do that. So that's the direction I think we should move. 2014, be self-insured. Start the clinic now. Work out the agreement with Palm Beach SO. Spoke to Sheriff Broward just today to let him know we were talking about Tenet. He said, I'm on board. So I think that's the future. That way, we're in control of our own destiny. We're not at the mercy of these insurance companies.
In designing the plan, would the employees have a part in designing this plan?
Absolutely. Here's the thing. There's so much, I'll say, garbage that goes out on these blogs about these mysterious Cadillac health plans that are out there. There's no mystery. I have the same health care plan as you do. My deductibles, my co-pays for everything are the same as yours. There's only one health care plan in BSO. Everybody has the same plan. As a cancer survivor, I have a vested interest in making sure I got a good health care plan because I can't go get insurance somewhere. I can't get life insurance. So as a cancer survivor, I got a vested interest. We all did. So the plan is we're going to design the plan as a group. And again, if people don't like it, then we blame ourselves. One thing just on healthcare real quick. Right. There's a side issue. I don't know if anybody read 401 Friday on workers' comp. Back in January, I went to the county to take workers' comp back. And this is kind of tied into healthcare because if you get hurt on duty. Many years ago, a previous sheriff, we had workers' comp ourselves, the workers' comp program. We did our own workers' comp. That sheriff decided to give it back to the county, or to give it to the county, not give it back. They never had it. We always ran it ourselves. And so this sheriff gave it to the county to run, and it became part of the county's workers' comp program. I don't know if anybody's ever tried to deal with them over there. I got a lot of feedback about, customer service isn't that good, take care of their own employees first. I heard a lot of feedback that wasn't good. About can't get an appointment with the doctor, don't like the doctor. They tell me which doctor to go to. I can't go to my own doctor. I can't go to a BSO doctor, blah, 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 blah. Back in January, part of the agreement back then, we just had to give 45 days notice to take the program back. So in January, I wrote him a letter. I gave him 45 days notice, we're taking it back. So effective October 1st, we're taking back workers' comp ourselves, and we're going to run it ourselves. And just like self-insurance for healthcare, When we run it ourselves, I think we're in a better position. We're not relying on an insurance company, the county, nobody but ourselves. So October 1st, we'll be running it ourselves. We're bringing everything back here, even the old cases. Part of the disagreement was they wanted to keep the old cases and only let us manage new cases. I said, no, I want them all. And so, if you know anybody that's out on a workers' comp issue, we're going to be taking that back October 1, and we're going to manage that in-house. Believe it or not, you guys come to me, I want to come back to work, but the doctor won't let me come back to work. And I'm going through all these hurdles. So I want to run it ourselves. So effective October 1, we'll be running our own workers' comp.
Questions, ladies and gentlemen?
Along those lines, will that be run out of the PSB?
Yes. Yep, we run out of risk management. They're giving us the funding to run it ourselves, so we'll be hiring a couple more workers' comp specialists to run it ourselves.
The money for OSSI, where is that coming from?
It's all LETF. Those are two things, the helicopter and LETF. Are both out of LETF. The helicopter was $6.5 million. OSSI was $5.7 million. I know when you have an interim report writer for 7 years, it's not interim anymore. And we tried with Motorola, they didn't succeed, we kicked them out, and we've been going slowly but surely with OSSI. That's one of my priorities, is to fully implement OSSI. We've been playing around for years on trying to get a decent records management system, so that's going full speed ahead. But as an example of working with the county commission on the helicopter and OSSI, that's money that we took from bad guys. We did the work, and we're entitled to spend it on things that help the agency. Helicopter and OSSI were the two priorities. We could have never funded those $6 million and $5 million out of the budget. Could have never done that. So, kept out of LETF. But two commissioners voted against that. And they were two commissioners that you endorsed. And to vote against a helicopter, which saves lives and helps us do our job, and OSSI, which makes the deputies writing the reports life a lot easier, for both of those to get voted down. I mean, it passed 7-2, but for anybody to vote against that, I don't know how that happens. And that's where I was a little disappointed that we didn't go together. We should have gone together to those two commissioners and convinced them this is life safety, and this is, an operational issue on the street. Not one penny of taxpayer money is going into either one of those. How could you vote against that? I don't know. I don't get it, but at least the other 7 permit.
You may close. We've finished our questions with you.
Okay. I just wrote down some notes that I wanted to cover over the past 5 years. I think we've made a lot of great strides. One is in the area of training. When I first got here, we were trained 2 days a week, and I got a lot of complaints about the training, sitting in class all the time, and topics that people said, we're never going to use this. So we went to a 3-day schedule on training and more tactical training, officer survival training. So now that every 3 or 4 months, we're doing tactical training, officer survival training, stuff that people can use every day. So we went from 2 days a year to 3 days. The way it was, you could have not had training for like 20 months. The way the schedule went, you'd go 20 months with nothing. That's not good. From a safety standpoint, that's not good. That you don't have any kind of training for 20 months. So that to me was a big mistake. We did the 3 days and more tactical. Use of SWAT. Unfortunately, we had the terrible incident with Todd Fada. You know that there were decisions made in that incident because somebody didn't want to pay SWAT overtime. And I manned up on that lawsuit. I turned around and said, you know what, we made a mistake. And it should have never happened. Those deputies should not have been serving that warrant. It should have been a SWAT team. We all knew it. I didn't need a jury to tell me that. I knew we made a mistake. Wasn't anybody in this room, it wasn't me. But we should own up to a mistake that got a deputy killed. And I told the family, I apologized to the family. But we had to put a policy in place that now all warrants are reviewed by SWAT. If there's any history of guns being used or weapons being in the house, SWAT will come in. And we put that into a policy. But that's a major mistake, and that was the first couple of months. What we did 3 years ago on the first responder pay, we did that. We've done a salary compression survey, which I know you're very interested in. And, you know, my goal is to look at that, because that's an issue that, hey, I've been here 34 years. That's been an issue ongoing, you know, salary compression. We should have a set amount between ranks. That makes sense. I can relate to that because when I was the chief in Deerfield, my executive officer was making more money than me because of his seniority and longevity that I didn't have. So I understand. I've been in the position. It's not good, but we got to try to fix it. How do we fix it? When do we fix it? Where do we get the money to fix it? It's my goal to fix it. Okay, so we commissioned that study, and you know we have the numbers that it's going to take to fix it, but you know we have to try to budget. 12-hour shifts. That was an issue that everybody said they want. We looked at it for 6 months. We looked at 2 12s and 2 8s. We looked at 2 12s and 10s. We had the North Loyal model. We had the Pompano model. We had the District 5 model. We looked at every possible model. When I was a deputy, I was happy if I got Wednesdays and Thursdays off. Now, everybody, what are you laughing for? Now everybody gets a piece of the weekend, okay? I think that's a great thing. You want to coach your kids soccer, baseball, you want to spend time for birthdays, everybody gets a piece of the weekend. That was the advantage I saw of 12-hour shifts. Going back on healthcare, we came in with option 4, which is that HMO open access. So if you don't want to pay any premiums and you want to take the risk, or you're single and you got healthy kids, or you're healthy, the option 4, it gave everybody an option. That if you don't want to pay, you pay a little bit more in co-pays, a little bit more in deductibles, but you don't pay anything. You don't pay any monthly premium. That's a pay raise that I looked at. And that's an option that we told Coventry we want that option. And so now if you choose that, if you want that, you can do it. We talked about the health clinic, self-insured, all that stuff. Operationally, things that we tried to get before but we didn't get. We just also LATF new bulletproof vests, going to a better, lighter vest. The tactical carriers. We had everybody buying their own tactical carrier. We had green ones, we had black ones, we had blue ones, we had 2-inch letters, we had 3-inch letters. I'd go on a scene or something, I'd swear there was 10 agencies there. And it was one, it's us. So, said, that looks like crap. Fix that. So we're going out, we're issuing tactical bulletproof vest carriers to all non-uniform personnel. Okay, makes sense, looks better for us, we should do that. Canine deputies, they came forward and they said, you know what, we go in a building search with our dogs. The dog has a bulletproof vest, we got a bulletproof vest, but we're like sitting ducks. What do you want to do? Well, we want these bulletproof shields that when we go in a building entry, we can carry. No problem, that makes perfect sense to me. Got a hold of Colonel Gillette, buy them. Don't you want to know how much they cost? No, buy them. Those stuff makes sense. OSSI, we talked about. Contract cities. It's our bread and butter. We're at the point where now like 60% of the DLE budget is contract cities. But we've been very successful. Pompano talked about wanting to go back to their own department because they did it cheaper. Everybody came out. You guys worked the community. And we fought that off. They signed a 5-year contract. We've been having the same issue with West Park. Pembroke Park, and now Southwest Ranches. But nobody can do it better. They can argue the finances, but nobody can do it better than us. So we've re-signed a lot of these contracts. Some of them we re-signed without a peep. North Lauderdale, re-signed that one, you didn't hear anything. So we're going to continue to do that. But new stuff too. Broward College. Broward College put that out to bid. Davie bid on it, Pembroke Pines bid on it, we bid on it. They wanted a college security unit to handle all their campuses. Obviously, the only ones with countywide jurisdiction. Made sense. We got that contract. Mass Transit kicked us out. The bus drivers went crazy. They said, no, we need BSO on these buses. So Mass Transit got us back. Charter Schools USA. Everybody talks about charter schools and private schools and all that stuff. Charter Schools USA came to us. You know, they're tax funded, but they're not tax funded and all that. They're a charter school, but they say, you know what? We want SRDs in our schools. The city's not going to pay for it, but we'll pay for it because we think it's a valuable thing for parents and for kids. So I said, sure, let's sit down with you. We sat down and we negotiated a deal with Charter Schools USA to get school resource deputies in there. Promotions. When everybody else is downsizing and laying off and freezing and cutting pay, we've been able to hold our own, keep what we got. We promoted 66 people in DLE since 2008. Just off this last list, sergeant and lieutenant, we promoted 23 sergeants and 9 lieutenants in 2 years, less than 2 years. Show me an agency that's doing that. On top of that, 66 total, 5 captains, 2 majors. I don't see any other agency out there that promoted 66 people in 3 years. I don't see it. Basically, just to close, you know, I've got a vested interest in this agency too. I've been here for 34 years. I'm proud of the fact that somebody finally came up through the ranks. It's the only job I've ever had. I've spent half my life at BSO, and I want to make sure we leave it, you know, in good hands. And that's the whole idea. We can run this agency. We know what to do. We know how to do it. The more control we have it, whether it be health insurance or workers' comp and those kind of things, negotiating our contracts with these cities, we need to keep it in our hands. My opinion, we don't need anybody from the outside to come in here and tell us how to run this agency. We are all perfectly capable of doing it together. But it takes a united front. It takes communicating. It takes working together and going forward. We talked about some of those issues. It takes commitment on both sides to do that. And I'm committed to doing it. I wouldn't be doing this again if I wasn't. So, thanks for your time.